And I would invite all of you who have questions to please jot them down. You have in front of you a notepad. We will be happy to answer your questions during the break, after the break, as we get into the conversation a bit more. We have just time for 2 questions at this time, and those 2 questions, the first question for my esteemed panelists. I'm a firm believer that what we think about, what we speak about expands. What are we doing right that we can build upon in this space?
What are we doing right that we can build upon? I'll tell you what we're doing wrong first. Okay.
How much time we got?
What we're doing wrong is that we are not communicating better and educating our Black patients on the clinical trials that are available. So that is a really, really bad thing. What we're doing right is that ASCO, they are now putting this at the forefront of everything they're doing. So if you look at ASCO and the ACC and other big institutions, everything is about increasing minority enrollment in clinical trials. So one day we will get there. It's a long way to go, but we will get there one day.
Thank you. Valerie?
Yeah.
So I think what we're doing right now is looking at our communities as real people. And so we're going out to our communities and talking to people about clinical trials. I think the hardest thing that we can do, the hardest thing to do, is talk to someone about a clinical trial and they've been diagnosed with a cancer. So if we can get people before they're diagnosed to even have a basic understanding of clinical trials, so when they walk through our doors, it is not a foreign language. So what we did at Duke was invite our oncologist, Dr. Lola, came to my church, and she taught about breast cancer and about clinical trials. And so now they knew that there was a person there that they could look at, and it wasn't a foreign person. So I think this whole community thing, I hear more about it now, and I think we have to expand on it. Everybody, well, I'll tell you about the Black community. In October, there's a Pink Sunday going on somewhere. So why not use that to expand, just not about breast cancer, about clinical trials as well. And I can talk about that forever, but I think that's a good thing we're doing.
That's incredible. Our last question for this session is this. When you look around this room, pharma is representing. Pharma is in the house today, right? I would invite those who are from pharmaceutical companies from the biotech space to just stand really briefly and just be acknowledged.
Woohoo! Woo! Yeah.
So we can see it, right? It's visible. They're here. They're showing up. They're at the table, but clinician registration is low for this event. Ooh. What can be done to increase representation by doctors, by physicians in the advocacy space?
Education, education, education. So we really have to start educating people in the community about increasing representation of Africans and Black Americans everywhere. Yeah.
So I think we talked about just ask. So why not just ask the oncologist to come to a community event? If we're going to just ask about clinical trials, we as patients, then let us just ask the doctors to come to our community.
Right.
Just ask.
Right.
Yeah.
And invite everyone to the table. Yeah.
Yes, Dr. Lola?
Thank you too. Can you all hear me? Yeah. Okay. Thank you to the panelists and to Dr. Gary for moderating. I do want to bring up the point though about the limited time in the clinical encounter and the pressure that is on clinicians to fit a lot into a very short slot. And you know, the problem is also with the COVID-19 pandemic, people have been stacking their problems and not seeing their doctors. And the number of patients who've come in to see me for breast cancer who also have uncontrolled diabetes, a neglected cardiac problem, you know, it's really been striking. So I will also put it out there that, you know, doctors are human, we are burning out. I think part of it is we need to engage payers and health systems to also give clinicians the space and the reimbursement and the acknowledgement to include clinical trial discussion, but in general, a more holistic approach to care in the clinical encounter and being reimbursed for that. Because until that happens, there's no way to fit it in. There's too much pressure on that clinical encounter. So I just want to put that out there too.
Good, thank you.